San Diego County reported today that the number of local COVID cases jumped to 45,000 in a week. That's nearly a 10-fold increase in 1 month.
But because of people self-testing at home or not testing at all, that number actually could be underreported. News 8's Abby Alford explains what you should do if you test positive at home.
If you're able to find them, many people are taking these COVID antigen home tests, and the county predicts that the number of cases could be much higher than the 57 new infections recently reported, since many people may test positive and not report it or don't take them at all.
The onset of COVID symptoms.
That I had fatigue, loss of appetite, then I had a fever.
Mission Hills hairstylist Becky Webster, who's fully vaxxed and boosted, took an at-home COVID test on Christmas and the following day. She tested positive on both. She says she wanted assurance, so she went to the Broadway Health test site at the Old Town trolley stop where they promoted 1 to 3 day results.
Here we are, 10 days later, I have no results.
Darcy Johnson says that she couldn't find a test when her boyfriend got COVID, but she felt all the symptoms.
And I'm going to isolate regardless. And, I've been sick for quite a while now.
Under CDC guidelines, you do not need to take a PCR test if you test positive at home, but you do need to isolate. Though San Diego County only includes PCR results in their numbers and antigen tests if observed by a medical professional.
What I do think they should do is go tell their doctor.
Chief of Infectious Diseases and Global Public Health at UC San Diego, Dr. Davey Smith, says regardless if you are vaccinated or not, what type of test you took or didn't take, or if you were exposed, doctors should be notified in case symptoms worsen, and they can treat you before hospitalization or death, especially if you are high risk.
There's a lot of stigma associated with COVID, and it breaks my heart, to be honest, how much stigma is out there.
Rady Children's Hospital Director of Infectious Disease, Dr. John Bradley, says the same for kids.
If you're a child with a cold and you've got an antigen test that's positive, that's good enough, certainly for the medical community, to say you've got it. You don't need to repeat it by PCR.
So while Becky Webster may not need a PCR to confirm, she did say that she isolated until symptoms went away, but she still just wants to know if she got COVID.
For personal knowledge, I just felt like I should know.
I'm Abby Alford for News 8.